This segment sponsored by GBMC Healthcare.
The school bell has rung, but the question is, can you hear it?
That's right. Joining us today to talk about your child's hearing and what to be concerned about is GBMC's Dr. Regina Presley. Welcome.
Good morning.
So tell us, why is it so important to catch hearing problems early?
Because it's imperative that kids have adequate hearing to develop speech and language in order to be able to learn appropriately, as well as for social interaction.
So what are some clues that parents can look for when trying to assess their children's hearing?
Are they asking for repetition? Are they not able to follow directions? Do they ask, huh or what? Or maybe they're sitting close to the TV and they're turning it up loudly.
All right, so at what age should kids have their first hearing test?
So actually in the state of Maryland, kids are having a hearing tested before they leave the hospital, so that will be their first hearing screening. And then by school age, they will have a preschool, kindergarten, first grade, and 8th grade, and anytime you move to a new school.
Oh, okay.
So how often should kids go for an exam in between? Should it just be from
It would
birth
be
until...
during those hearing screenings, and then anytime a parent has concerns, any concerns at all, mention it to the pediatrician and start with a hearing screening.
Okay. So what's the difference between a hearing screening and a diagnostic hearing test?
So a hearing screening is a brief, quick test where the kids are only listening to a few different pitches just to see if those are within the normal range. A diagnostic test is much more involved, and so it's looking at a range of pitches. So if you think about like an equalizer on a stereo, and we're looking to see the softest sound that children can hear. So it's much more in-depth, and it helps also to determine what the cause of the hearing loss may be.
So is there anything that parents can do to help their kids prepare for one of these screenings?
So if they're school age, really if they've got the I can raise my hand down pat, really what they're going to be asked to do is raise their hand even when they hear a soft sound. For those kids who are younger and maybe just beginning school, it's really about playing games. Maybe have your kids listen, throw a block in a bucket when you make a sound and make a game of it, or maybe use puzzle pieces to turn it into a game.
Okay, and I know that a lot of kids are going back to school, so they have their headphones in where they're going in and out of school and on the bus.
Yes.
So what can parents do to help protect their children's hearing?
So first and foremost, set those limits on the loudness of their devices. So the rule of thumb is 60-60, 60% of full-on volume for no longer than 60 minutes at a time, and give their ears some rest.
Okay.
Okay, so tell us again some of the tips, and I guess then the ages that parents should be looking for if they think that their kids have a problem or if they see any concerns.
So for younger kids, I would look for, do they need repetition? Maybe they're not developing speech as quickly as some of their peers, or maybe their speech is hard to understand. Maybe others can't understand them. As you're getting up in age, the kids, you'll start to see change in social interaction. You may see a decline in their performance academically. Again, things are turning up too loud, not following instruction properly.
Very good. And tell us where we can find all of these back to school tips. Is there a website that you have?
Absolutely. You can go to gbmc.org/Cochlear, and that will give you a lot of information about hearing loss.
Well, very good. Thank you so much for being with us today.
Thank you for having me. It was a pleasure.
Thank you.
And don't worry, there are back to school tips to help your parents protect their kids' hearing, as you said. Repeat the website one more time.
gbmc.org/Cochlear.
Thank you so much.
Thank you.